Good morning. I am Ms. Sujata Tiwari, Assistant Professor K.M. Agrawal College, Kalyan. In the present session, I am going to highlight stress management. Stress management is a wide spectrum of techniques and psychotherapies aimed at controlling a person's level of stress, especially chronic stress, usually for the purpose of improving everyday functioning. In everyday's materialistic life, everyone experiences the stress due to one or other reason. To cope up with the stress, it is important to understand what is stress, what are the symptoms of stress, what are the causes of stress, and most important is how to overcome the stress. Stress is normal part of life. You can experience stress from your environment, your body and your thoughts. Even positive life changes such as a promotion, a mortgage or a birth of a child produce stress. Medical definition of stress. In a medical or biological context, stress is a physical, mental or emotional factor that causes bodily or mental tension. Stress can be external from the environment, psychological or social situations, or internal, illness or from a medical procedure. Stress can initiate the fight or flight response, a complex reaction of neurologic and endocrinologic system. Stress can cause or influence the course of many medical conditions, including psychological conditions such as depression and anxiety. Medical problems can include poor healing, irritable bowel syndromes, high blood pressure, poorly controlled diabetes and many other conditions. How does stress affect health? The human body is designed to experience stress and react to it. Stress can be positive, keeping us alert, motivated and ready to avoid danger. Stress becomes negative when a person faces continuous challenges without relief or a relaxation between stresses. As a result, a person becomes overworked and stress related tension builds. In psychology, stress is a feeling of emotional strain and pressure. Stress is a type of psychological pain. Small amount of stress may be desired, beneficial and even healthy. Positive stress helps improve athletic performances. It is also play a very important role in motivation, adaptation and reaction to the environment. Excessive amount of stress, however, may lead to bodily harm. Stress can increase the risk of strokes, heart attacks, ulcer, mental illness such as depression and anxiety, and also aggravation of the pre-existing condition. Physical signs of stress: racing heart, cold sweaty hands, headaches, shallow erratic breath, nausea, upset tummy, bowel problem, shoulder or back pains, rushing around, walking longer hours, fatigue, sleep disturbances, weight losses, changes in appetite, alcohol consumption are the physical signs of stress. Now see the types of stressors. A stressor is any event, any experience or any environmental stimulus that causes stress in an individual. These events or experiences are perceived as a threat or challenges to the individual and can be either physical or psychological. The stress can be classified into 4 categories: crisis or catastrophe, major life event, daily hustle or micro stressors, and ambient stressors. Crisis or catastrophe. This type of stressor is foreseen and unpredictable, and as such is completely out of control of individual. Example of crisis and catastrophes includes devastating natural disasters such as major floods, earthquakes, wars, tsunami, etc. Major life event. Major life event. Common examples of major life events include marriage, going to college, school, death of a beloved one, birth of birth of a child, divorce, moving houses, etc. These events, either positive or negative, can create a sense of uncertainty and fear, which will ultimately lead to stress. Daily hassles, micro stressors. This category includes daily annoyances and major hassles. Example includes making decision, meeting deadlines at work, school, colleges, etc. Traffic jams, and often this type of stressor includes conflict with other people. Travel based related stress results from 3 main categories: lost time and surprise, and routine breakers. Ambient stressor, as the name implies, are the global low grade stressors that are the part of background environment. For example, as an instant we can take pollution, noise, traffic, overcrowd, etc. Organizational stressors. Studies conducted in military and combat fields shows that some of the most potent stresses can be due to the personal organizational problems in the unit or on the home front. Stresses. And most probably the stress due to bad organizational practices is often connected to the toxic leadership both in companies and in the government organization. Stresses impact communication. Language barrier can cause stress by making people feel uncomfortable because of differences in syntax, vocabulary, different way of showing respect, and different use of body language can make things difficult. And along with the desire for the successful social interactions, being uncomfortable with the communication around a person can discourage them from communicating at all. Changing in the home, divorce, death, and remarriage are all disruptive events in the household. Although everyone involved affected by events such as, but it can be most drastically seen in children. Due to their age, children have relatively undeveloped coping skills. Stress management. Now, the most important is how to cope up with these stresses in our day-to-day life. There are some strategies to overcome the stress are: keep a positive attitude. Always keep a positive attitude. Accept that there are events that you cannot control. Be assertive instead of aggressive. Assert your feelings, opinions, or beliefs instead of becoming angry, defensive, or passive. Learn and practice relaxation techniques. Try yoga, meditation, or Tai Chi for stress management. Exercise regularly. Your body can fight stress better when you are fit. Eat healthy, well balanced meal. Learn to manage your time more effectively. Time management really matters. Set limit approximately and learn to say no to requests that would create excessive stress in your life. Make time for hobbies, interest and relaxation. Get through rest and sleep. Your body needs time to recover from stressful events. Seek out social support. Spend enough time with those you enjoy. Seek treatment with a psychologist, psychiatrist, or other mental health professional trained in stress management or biofeedback techniques to learn healthy ways of dealing with the stress in your life. Thank you.